Asymptomatic COVID-19 patients will be released from isolation centers for home and community-based care. The government is set to roll out protocols that will determine those who will qualify for home-based care, with the country's main isolation centers at Mbagathi and Kenyatta University hospitals almost full to capacity. The move is aimed at decongesting isolation centers as the number of new infections remains on an upward trajectory. The country now has 2,340 cases after 124 new infections were confirmed today. KTN senior reporter Rita Tinina has the very latest for us.
124 people have tested positive from 2,640 samples.
The new figures bring the country's COVID-19 cases to 2,340. 4 more people have lost their lives, raising the number of deaths to 78. 39 people have been discharged, bringing the total number of recoveries to 592. With 2,340 cases, 78 deaths and 592 recoveries, the country has 1,670 active cases, and it appears hospitals are beginning to get overwhelmed by the numbers.
Both Mbagathi and KU are already getting to full status.
With over 80% of COVID-19 patients being asymptomatic, the government is now adopting a different approach in handling such patients.
Is that a lot of people who are in isolation facilities may be released to be taken care of at their homes.
And this is a key intervention that is approved by the World Health Organization, and it is meant to decongest health facilities.
Protocols that will determine who qualifies for home and community-based care are set to be released.
And where families are not able to either self-quarantine or self-isolate, the government will still assist in the process.
Of the 124 new infections, Mombasa has the highest number, 40 cases. Nairobi has 38, Busia 26, Kajiado 6, Kiambu 3. Garissa and Taita Taveta have 2 cases each. Murang'a and Elgeyo Marakwet 1 case each.
Elgeyo Marakwet becomes the latest county to report a COVID-19 case.
In Mombasa, of the 40 new infections, the highest number has been recorded in Mvita, which has 14 cases. In Nairobi, of the 38 cases, Kibra yet again has the highest number, 25. On Wednesday, 20 cases were recorded in Busia, all of truck drivers. On Thursday, the 26 cases confirmed again were of truck drivers. The drivers are required to test for COVID-19 48 hours before embarking on a journey. Many end up at the Malaba and Busia border points without a certificate, and Kagwe is pointing fingers at the police.
Unafikiri alipita namna gani kutoka Mombasa mpaka akafika Busia? Alifikaje huko? Na wale askari walikuwa hiyo barabara, ni hadithi gani wanaweza kutupatia vile huyo mtu alipita?
The government is yet to trace over 140 people who tested positive but are still at large after providing wrong contacts.
There is nothing to stop the Ministry of Health from publishing photographs in the newspaper and telling them these persons have run away from a quarantine facility, and if you see them, please call the police or call us.
With 36 of the 47 counties having recorded COVID-19 cases, the national government has disbursed 5 billion shillings to the 47 counties in a conditional grant to boost their efforts to handle COVID-19. Rita Tinina, KTN News.